Hi everyone, I'm Timson. I will talk about the third Sustainable Development Goal of the United Nations, the good health and well-being. My research content is divided into project introduction, precedent analysis, and the design method. I focus my research on achieving universal health coverage, including access to quality essential health care. The problem space is mainly for the distance of patients seeking medical treatment, has to do with China's healthcare system and its vast geographic location, the urban-rural gap. The patient's trust in hospital brands has led to overcrowding and longer waiting time. The patients and the public perceptions, preferences, and behaviors are very essential in the issue. The top hospitals, usually located in big cities, attract large numbers of patients, leading to overcrowding. Family members are their most immediate caregivers and escorts. Eventually, the product will be available to patients living in remote areas of rural areas and towns, and to anyone who needs it. Conceptual mapping has helped me to rank the importance of cases requiring multiple trips to the hospital. I found that the bone fractures, the paralysis, and the mental disease depend most on the hospital rehabilitation system. Observing the advantages of hospital rehabilitation and the characteristics of home rehabilitation has inspired me to bring the benefits into the home. One of the most interesting is the rehabilitation of hemiplegia after the stroke. In analysis, seeing product precedents, I chose 3 products, technologies, and service systems that best represent the telemedical. The report doctor is an example of applying artificial intelligence to medicine. In hospitals, they significantly reduce the stress on doctors and help doctors batch tasks. The video clinics become popular during the COVID-19 pandemic, solving the pain point of patients needing to see a doctor when isolated at home. Japan's remote employment robot has provided me with a concept that can be remotely controlled. So, can doctors remotely control the equipment to help patients with the remote treatment? It's a very interesting question. Now is the time for a speculative approach. Based on the 4 keywords of my scene from the future, I envision the next decades as medical research and technology evolve, and the tools to treat disease became more advanced and diverse. My storyboard describes a practical use scenario of wearable devices in the medical field. The device can record the patient's condition and data. These GIFs can well mirror the mood changes of patients during the rehabilitation. The patient's mental journey, these mood changes depend entirely on the stage and effect of rehabilitation. I list the scenarios at different locations and finally found some opportunities, close communication between doctors and patients, to the fun of virtual methods, and 3, sharing of recovery data. From the analysis of persona, some opportunities for home devices are drawn. It's an opportunity to put home devices on the patient's journal map in the line of sight. Finally, I analyze how to solve the problem of the distance and access to medical service from 4 perspectives: social environment, economic, Chinese cultural background, and the patient's behavioral habits. the four perspectives can be developed together to increase the breadth of thinking. Thank you.